I don't know how much your viewership is aware of how terrible the American healthcare system is, but yeah, it's not the easiest to navigate. My name is Max Gavrich. I'm an artist and photographer and educator. I've had COVID twice now. For a long time, I was like, this is not COVID related. This is just me being exhausted from school, from life, after about 6 months, and just like still not having much energy. Um, dealing with a kind of depression, which I've also dealt with. I have cerebral palsy, which is like a neurological disorder that I was born with. And I know people with CP and with other neurological disabilities um, can be hit harder with COVID, but yeah, I haven't really acknowledged that until now. It's certainly a factor. I would say I've had trouble finding the right resources, or just like getting connected. I've been on Medi-Cal, which is like the California state healthcare. It took me like about 4 months to see a doctor, um, probably longer actually, because it was like I made an appointment for 2 months in the future, and then my doctor got sick, so she canceled our appointment. So we had to reschedule, and then I was sick, so it ended up being like around 4 or 5 months until I got in to see a doctor because of COVID. The system is stretched thin. Doctors, mental health care workers, nurses, they're all overworked and exhausted. Even now, like years later, the system isn't um, strong enough or like prepared enough for to handle the needs of the American public. I feel privileged to be able to get access to healthcare and to be in the system, but because there are people who are not even um, getting what they need. I think maybe people are less worried, but it's still ever present. I mean, I teach both college and high school, and I every class I have a number of students out sick, and I think it's been COVID, it's been the flu. I think it's also just mental health, like anxiety, depression. So I think all these things are connected in certain ways. I don't think it's over. So like, yeah, Biden can say whatever he wants, but I don't think that's the case.